Hello, everyone. It's Ashley with Amare, owner and founder of Amare Healing Arts, Plastic Surgery Recovery Center, and Holistic Clinic, specializing in manual lymphatic drainage. We have two locations in New Jersey, Highland Park and Elizabeth, and I also offer virtual consults. If you're not in New Jersey but still need help with your recovery, you can give the office a call at 732-841-0142 to set up your sessions. We have our post-op shop where we offer post-op supplies like Lipo Foams and BBL pillows, and I teach you guys how to use those products with the videos that we have on our product page. That's amarepostopshop.com. We also have our online courses where I teach you guys what massages you would need after plastic surgery, when to get your massages, who to get them from, what the lymphatic system is, what lymphatic massages actually are, and all the research that you would need on your post-op massages and finding a lymphatic therapist. All of these links are in our bio as well as in the description boxes, so you guys can go and check that out. I will see you guys soon. Ashley with Amare. Bye.
I am a board certified massage therapist, and I'm also an approved provider. So I have a massage school that helps massage therapists who want to help people after plastic surgery. So I am here on this live. I'm going to be joined by Ashley from Amare shortly, and she and I are going to discuss the dark side of the post-op industry. So I have some notes here, and I think that she will have a lot of input and be able to give us a lot of insight. Thank you so much for the comments into this, because I have a very particular practice here in San Diego and she has a practice in New Jersey, so we can give you an East Coast, West Coast perspectives. She takes far more clients straight from Miami than I do. So I see that she's here, but I think there's so many people are coming on. Ashley, can you ask to be asked to come on, maybe? Or leave a comment and see if I can get you on. Are tips expected for post-op massage, even though our medical service? I do not, I don't expect tips. All massage therapists should not really expect tips. It's nice if they give them to you. See, add as moderator. I wonder if I can add you. Oh. I can add you as a moderator, but I don't know how to add you as a person. I'm not that old. Haha. Okay, so she should be coming in. Here she is. I see your computer, and there she is.
Hi.
How are you?
Good. How are you?
Wonderful. So I'll start just by, and you're fine on your side with the camera and the recording and stuff? Good. Yep. So I'll start by just saying briefly who I am and then saying who you are, just so we can kind of let people know who we are. My people might not be familiar with you, though I am, and I say Ashley from Amare all the time. So my name is Kathleen Lisson. I'm a board certified massage therapist, certified lymphedema therapist. I have a practice in San Diego, California. I am 100% plastic surgeon referred. So all I do is post plastic surgery, and all the people in my office are referred to me by their plastic surgeon. And I give a combination of manual lymphatic drainage and post-op massage and fibrosis massage to the clients. I have actually a wide variety of clients that I serve, anything from like they had cancer and they're having reconstruction with autologous fat transfer to the breast. And then I also have Dr. Torres from Skin and Skinnier, who refers some clients to me, and he does a Brazilian butt lift on a smaller frame client, and kind of everything in between, a lot of breast surgery, tummy tucks, and body lifts, some kind of bigger surgery after massive weight loss, just all kind of different things referred to me by their surgeon. And I also have a school where I teach fellow massage therapists who want the continuing education credit from Nick Timba. I teach post-op massage and then also like facelifts, tummy tucks, after cancer surgery, all different kind of classes in my school. And I met Ashley, I believe, because you took one of my classes, right?
Yes, I did the fibrosis and plastic surgery massage one. I think I took 2 of them actually.
Yeah, I think you've taken a few. So tell them about you, which I wanted to say that right as you were taking a drink.
Okay, are you ready? Are you ready? It's Ashley with Amare. Every time Kathleen calls me, she goes, "Who is this?" And I'm like, "Ashley?" She's like, "Ashley from where?" And I'm like, "Ashley with Amare." So I've been doing manual lymphatic drainage, specializing in manual lymphatic drainage for 7 years. I started in cancer recovery as well as cancer surgeries and lipedema and lymphedema surgeries. So that whole like surgery part of it and cleaning up the body and all of it is the heavy duty stuff. I started my practice like full force, seeing people get 6-7 liters of lipo taken out of their legs in one shot, full reconstructive repairs, full knee surgeries, hip surgeries, autoimmune diseases, Lyme, all of that stuff, recovery for all of it. So I also do medical massage. I'm also a yoga instructor. I'm also a holistic health counselor, blah, 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 blah. But the thing that I love the most is manual lymphatic drainage. So I'm VODR and Foldy certified, all that great stuff that I say all the time. So I am totally addicted to it because I've seen how much it works on my clients over the past 7 years. As far as post-op, about 3 years into my practice, as I started promoting manual lymphatic drainage more, people started finding me after plastic surgery and would come in and I would be like, "Whoa, what'd you have done?" And they're like, "Liposuction." And I'm like, okay. So that was like my first intro to it. And I started getting bombarded with clients because there's not a lot of people that do MLD in New Jersey. There's only a handful of us that, outright promote it and practice it and, are kind of really into it the way that I am. So I started seeing all these people. The surgeons weren't helping them. The surgeons weren't answering their questions. They didn't know what to do with the faja. They had no guidance. They were eating tons of salt, not drinking any water, all the wrong things. So I started doing some research into the problems they had. Like I noticed the same fibrosis they have from plastic surgery is the same as the ones you get from lymphedema or after a cancer reconstruction. It's the same fibrosis. So I started applying those methods, such as the lipo foams that we now have, and the garments and like CLT, like lymphedema bandaging and stuff like that, using that knowledge and applying it to my post-op clients. So I've been doing that for, the past 4 years with all my post-op clients. I didn't even know a post-op industry. Like I didn't know any of this existed. I was just doing what I know how to do and what I'm trained to do medically to help people within, my scope of practice. And I'd kind of like, go off of what their doctor said. But like you said, Kathleen, in the beginning, it is very different out here on the East Coast because we are so close to Miami. We are so close to New York. The surgeons don't want to talk to you. They don't want to answer your calls. I mean, I'm still sending out cards to the same people 7 years later who their clients, I've seen hundreds of them, and they go back to their surgeon and their surgeon's like, "Yeah, she's amazing." And they're like, "Okay, that's great. Sure, you can do that." And that's it. I have spent countless hours, 2, 3, 4 hours driving to meet a surgeon who wants to meet with me, see them once, explain to them for about 3 hours the entire science of MLD, and they don't care because it's not surgery and it's whatever to them. So it's really hard in the industry on this side for, I think, the post-op people in the world, or even just the MLD people in the world, massage therapists in general, to have any kind of, I guess, the same recognition as a doctor or a physical therapist. For whatever reason, the surgeons don't want to see us, hear us, know we exist. They just don't really care. So our industry on this side, being an MLD therapist is way different than on your side where you're very well respected. Surgeons are coming to you and asking questions and have those lines of communication. Because I remember when I was in school 7 years ago for MLD, Elisa DeFalco, my teacher, she works with surgeons. Dr. Rademacher is like her best friend. He's a hand surgeon. So, and he's a plastic surgeon, and she's in the OR with him, and they're like doing stuff together. And I remember she said, just go and introduce yourself, get into the plastic surgery conventions, call the surgeons, make yourself known, let them know what you're doing. So I tried that and nothing. Refused to even take my call. So then after 2 or 3 years, I started sending my cards back with clients, would throw them out, because then another client would go back and I'd be like, oh, well, how did you find us? And they'd say, on Google. And I'm like, you didn't ask your doctor? And they're like, I did, but they gave me some lady like 3 hours away and she doesn't do MLD. She does just regular massage. And I was like, well, I sent cards back 2 days ago. So that's weird. It's completely something they don't want to touch on this coast because they hear about all the complications and all the things and the liabilities, which, is fine. It just makes it harder for us and people to find us. And then a lot of our clients are confused and lost and a mess when we finally get them. And we really have to educate them on everything, which is why I started my Instagram, because they'd ask me so many questions within that hour session that I don't have time to answer everything, but I want you to understand. Because if you don't understand what's going on with you and the medical side of how it's supposed to be and how the body functions, you're not going to take care of it properly and you're not going to make the right choices. So I started all these informational videos on my YouTube, my Spotify, my Instagram, and all of that to give people some sort of actual proof and explanation behind what you're doing to take care of your body after surgery. So that's Ashley with Amare.
Yay. Thank you. So we are using some terminology that might be unfamiliar to someone. So I just want to kind of set the stage because we said lymphedema and lipedema. Not everyone might know that. So to look back at the history, so we're talking about in the 70s and 80s, the surgeons were finding that and even before that, but there is swelling and fibrosis happening to a client after they get oncology surgery. And before Dr. Lerner from New York City, there was very sparse level of people who are trained to reduce the swelling and fibrosis after these types of surgeries. So Dr. Lerner came in and he started training massage therapists in lymphedema care. He's actually quoted as saying the massage therapist is the ideal person to do this because they are most likely to dedicate their entire career to helping this client. So one of the people that he brought over to teach the therapists in America to help reduce swelling and fibrosis after surgery was Gunter Close. And so Gunter Close is in charge of now a school. And so I went to do my lymphedema therapy with that school. And there was Steve Norton and Joachim Zuther. There were several people that were sent over from a place called the Foldy Clinic. So when Ashley said she's Foldy trained, that's the Foldy Clinic, which is a clinic in Germany that treats lymphedema and lipedema. I was very fortunate to be able to go over there for a week and study and get some hands-on in their treatment rooms with my fellow therapists there to educate myself on all different ways to reduce, again, its swelling and fibrosis happening after surgery, after cancer treatment. So I think both of us, we started helping people with chronic illnesses, and that's where our training is from. And we're trying to bring that level of service to post-op clients and bring all these tools that we know as compression fitters, as certified lymphedema therapists. We get into these compression fitting classes where we see a lot of the technology and foams, flat foams, textured foams, different kind of garments as part of our formal education.
Facts.
Facts. So
everything we learn, right, as massage therapists, as MLD therapists, it's all based in some sort of medical something. Some MLD, manual lymphatic drainage, is created and discovered by Dr. Vodder, by a doctor. This isn't just something somebody made up, right? So fibrosis, seromas, lymphatic fluid, swelling, all of this stuff does have an actual medical basis to it. It's just really how you use it. And I mean, that's the same with any massage. You can use hot stones to relax or go deep. You can use them for trigger points. You can use them for, regular Swedish. So it's really all just how you use it, when you use it, and what you use it for. But it all still applies the same way.
Mm-hmm. Mm-hmm. So let's kind of dive into the subject. I'll tell you, it's close to my heart. Our clientele, because the last client that I had on my table, we actually had some schools had to close down today in San Diego because there was an active shooter threat. So this is definitely, yeah. So there's a
Wow.
lot scared parents. They called in some threats to the elementary school here in San Diego. And she works next to the elementary school, so she was having trouble getting to her appointment. And I was just like, you know what, like, there's no, take your time. Like, this appointment is not as important. We could always like cancel and reschedule. Like, you're in a more important situation. But it kind of, it really guided my attention towards the fact that knowing that when that client comes in, we have to stand and take a breath and re-regulate their nervous system. And this is something like my first class, straight out of massage school, oncology massage. Like, I've never not dealt with clients that had some kind of PTSD from their previous treatments. Because absolutely, when someone goes through like a year of cancer treatments, they're not going to get out of that like unscathed emotionally. And you have to be able to meet your clients emotionally where they are. And that moves through their entire life. So I'm real popular saying, you know what, I don't just treat what you came in for. Like, as massage therapists, we have to treat the entire client. We have to greet and be with that entire client. So our clients, they're worried and confused about their aftercare. That's the number one thing across the board. Every single time I've seen that conversation come up, people were like, you know, I felt like I didn't know everything I needed to know about the surgery. And I know you're very big adamant that our clients have to feel safe and secure with us before they can take full advantage of their therapy. And also a big thing with me, because like I said, the very first place I massaged people was at the infusion clinic at Moore's Cancer Center here in San Diego. Like, we can't have our clients settle for being in pain. Pain is a signal, and it's a message coming from the body, and we have to understand that message, and we have to acknowledge to our client that we're receiving the message that they're in pain. We can't, like, nothing good ever happened because someone ignored their pain. Like, that's actually the first step in a lot of nightmares, is like, you know, I just ignored the pain for a while, and then that's how you end up in an emergency room. So, and then I also love the thing that you said, that recovery is our client's responsibility.
Yeah.
They are in charge. They are in charge, and it's that way in our system of medicine in America for a lot of people. Like, when I had an injury, you know, like, you go to the surgeon and you get surgery, they refer you out to PT. And there's different people with different levels of expertise. So I wouldn't ask my surgeon complicated questions about PT, because my surgeon is going to refer me to the physical therapist to get rehab. And that's what, every time I've been injured, because I like to run, so I like to injure my hip over and over again. And I go to the physical therapist, and the physical therapist is the person that can have that conversation to me and get me to the result that I want to. And realistic expectations are key. And that's the final thing. And then I'll let you talk.
Well, yeah, I was just going to say that.
Are key. Yeah, and that's something that ideally, if you have a quality surgeon, so that's what's so beneficial of me working in San Diego and having the surgeons refer to me. I get to pick and choose which surgeons I work for, you know, that I let refer clients to me, because if someone got into doing a surgery that wasn't the best surgery for them, like the doctor wasn't the right doctor, didn't have skill, or the client wasn't prepared for the surgery fully, or that the surgery that they chose was not the right surgery for them, they're not going to get the result that they want. And that happened to me personally. I saw how this having a surgeon that's honest and works with you is so valuable, because when I went in for my facelift, I was like, oh, Dr. Brahmi, like, I need a rhinoplasty because I broke my nose, but like, maybe I'll have like a mini facelift. And he was like, you need a full facelift and neck lift. Like, you're not going to be happy with the results if I give, if I do this lesser surgery on you. Tell me what your goals are, and this is a surgery that will get you there. So having that high quality, knowing and trusting that you have the right surgeon with the right expertise. And a lot of it is like, would you do this surgery on me if I was your mother? Like, do you think that this is the best for me? Am I fully prepared for this surgery? Is there something that I should be doing in the next 6 months to prepare for the surgery, and then actually do all that? It makes such a difference in your recovery.
So I think that whole thing, like, here, we're going to paint the picture real quick.
Yeah.
So, cause that's a lot of parts. So this is where it starts. We see a lot of clients, and I mean, in general, this isn't just related to post-op, whether you're autoimmune cancer, your back hurts, whatever it is, right? Everybody just needs a hug. Everybody just needs to know that it's okay. So it doesn't matter if you are the most prepared on this planet for your surgery, and your surgeon is your best friend. Because I had a client who, her surgeon was like a really close family friend, and he was like, you need MLD, like, immediately. Go find somebody. I'm going to do the surgery. You're going to get the MLD. Like, that's how we're going to do it. And you got to go find somebody that's doing gentle MLD. So he gave her all the knowledge he could possibly give her. She came in, she still had so many questions and had no idea what to do. And even with him explaining the surgery to her, when I explain where the cannula goes in, how the tumescence works, how liposuction works, what's actually happening to the body when it happens, when I talk to them and explain to them and just listen to every question they have, and explain it to them in a way that they can relate and take it with them. Not just reading them the riot act of, okay, here are all the medical terms, but the same way I do in my videos, when I talk to them and I say, okay, this is why you need to take care of things the way you need to take care of them. This is why you have to wear your garment and your foams. This is what they do. This is how it works. They're like, oh, you know what? That actually makes a lot of sense. So like the two analogies that I gave you the other day, right? We're going to start with this, and then we're going to go through the whole journey of post-op from consult to when they walk in with us. So when you stub your toe, it swells. In no world do you cut the swelling out of your toe and squeeze blood out of it. That's not how the body's designed to work. When you get a tattoo, in no world are you coloring it in for 6 months straight with a Sharpie, because it's permanent and it's done. So relating to post-op, when you stub your toe, you don't have to squeeze fluid out of it. You don't wrap it in the tightest ace bandage humanly possible. And if you have done that before, used an ace bandage, it's been too tight, you know how uncomfortable that can get. We've all been there. We've all made that mistake. So that's like akin to a garment, is, squeezing in the tightest thing possible. You want to treat your body like it's healing, like it's one big open wound, because that's what it is. Just because you can't see it, you can feel it. You feel it. Oh boy, do you feel it. And the way you would take care of a wound is the way you want to take care of your body right now. So proper wound care, at-home care, which is our biggest thing at Amare, the at-home care that we, talk about all the time, making sure that you're resting, making sure that, you're using the proper things, getting the proper massages, all of that. The same way you would be gentle with your stubbed toe, you'd stay off of it, you'd take your time, you'd rest, you'd gently rub it. All of those things still apply for your post-op. You want to be gentle with your body, because it's not the stubbed toe, like, yeah, that hurt, but it's you constantly squeezing it into heels every day that's causing the problem, that's causing your struggle with that issue, and it's causing your post-op struggle too. So that's the big kind of ball of wax from where all of this, like, complications, fibrosis, pain, confusion, anxiety, hopelessness, the scared, the fear, the, oh my God, I'm going to look like this for the rest of my life. Oh my God, it's been 6 weeks and I still can't even touch myself. I'm so neurotic and I don't know what to do. And I panic book with whoever I can find because you're scared. And that's okay. You're allowed to be. This is a huge, huge thing for you guys. But being smart and gentle about it. Just doing safe post-op things, the same way you would do safe things to your stubbed toe. And the same thing with a tattoo, right? Once the color's in there with plastic surgery, once the cut is done, that's permanent. That's your result. but it's swollen, it's bleeding, it's a mess, right? You can't really see the lines of the tattoo the first couple days. You can't really see the ink because it's all gross. You got to put proper wound care on it. You got to bandage it properly. You got to keep it out of the sun. You got to drink lots of water. You got to do all those things. Is the same thing you want to do with your post-op recovery. The same way you would treat a tattoo is the same way you should treat your post-op results. You would not take a wooden roller to a tattoo. You would not use a heating pad on a tattoo. Tattoo is minor surgery. Ask any tattoo artist. They will tell you that. It's the same thing as minor surgery. But treating, the way that you're getting treated, the way that you're treating yourself, that's the key to your post-op struggles right there. That's the whole thing. That's literally it. You could be using all the arnica in the world. You could be getting the best MLD massages on the planet every single day. You could be in the most comfortable, perfectly fitting, like certified fitter compression measured garment. And if you are still taking a wooden roller to your body every day, you're going to have fibrosis because you're breaking tissue and not creating that full healing space. If we don't create an environment for your body to heal, you're not going to get your results. There's always going to be problems because you're constantly letting things you in through the door too. And I think a big part of it, again, starting from the beginning, is your consult with your surgeon. I mean, Kathleen, I know you're blessed with amazing surgeons, but out here, and I mean, I do virtuals. I see people from Texas, Arizona, Ohio, Canada, UK, California, New York, New Jersey, Miami, everywhere. I get them from all over. And some people have amazing surgeons where they will spend time, even just the consult, I don't want to say easing every worry, but addressing every concern. So you are 110% confident and comfortable with what you're doing. So with your whole anxiety, where that whole thing starts is if you're not comfortable with it to begin with. If you're not comfortable with your surgeon, and if you're not confident in your decision, and if you're not confident in, okay, I am prepared to take care of this afterwards, I'm prepared to figure out what I need, then you get into a big ball of confusion. It's all frantic because you're lost and you don't know what to do. Because if you have doubts about your surgeon to begin with, and then the day you get into surgery, you still have even more doubts because now you're worried that it's not going to go right because you have doubts. And then you get out of surgery and you're all on anesthesia and you have no idea what's going on. Then once you're out of the pain meds, 5 days later, you look at your body and you're like, what the hell did I do? Because you weren't fully present in the process. You didn't have that good feeling, that excitement that, yes, I can do this to begin with. And then when you come to us afterwards, your surgeon has kind of turned their back on you or not giving you answers. And even if they don't give you answers, just taking the time to listen to you and address your concerns and talk to you about it. They haven't done that. It's a quick in and out, especially in Miami. You don't ever see your surgeon except the day for surgery, and that's it. And then you go looking at all of other people's experiences and you get freaked out because other people are having bad experiences. And maybe some people are having good experiences, but they don't sound like the experience that you want. And then you're even more confused. Instead of just looking at the medical research, instead of just Google manual lymphatic drainage technique and read an article, instead of listening to everybody else. Make this a personal journey. Make this something you're excited about. Make this something you're going to learn about. It's not just you going through this, it's your body too. And if your body, like Kathleen said, is giving you any kind of a pain signal, whether it be anxiety, fear, nervous, overwhelmed, or physical pain, whatever that level may be for you, you might want to check in with yourself and figure out, okay, what am I doing? What's going on? Where are we? Because you have it in your head, you're going to do this, you're going to do this, you're going to do this, and then you just jump, and your body's not ready. Your body is the one getting the work done. You got to be present in it to know what's going on. So that pain signal, that worry, that initial nagging in the back of your head, I don't know, this seems a little too back and forth to me. This seems a little too complex. Google medical articles about things you want information for. Go right to the source and learn about what this is and really take part in this journey of knowing your body. Because when I'm done with my clients, because I give all this information out day one, They know so much more about how their body functions. And I cannot tell you how many clients, even after their post-op, are like, oh my God, you're right, I have a swelling problem. Oh my God, you're right, I've been eating way too much salt and I have edema constantly. Oh my God, you're right, I'm super puffy all the time. I didn't know this could help. Or whatever the case may be, because you're learning about your body. Because we're taking the time to explain it to you and talk to you and be here on this journey with you and listen to you and ease those concerns. Because again, if we don't get through all of that mind chatter, any knowledge Kathleen and I give you, you're not going to hear because you're so upset. You're so worried. And guys, you have every right to be. This is a huge thing for you. This is a huge surgery. But really taking the time to calm yourself down and arm yourself with the confidence and the knowledge, knowing what you're going into, and ask your surgeon. And guys, if your surgeon won't take the time to explain it to you, you might want to find another surgeon. Kathleen has a list. I mean, granted, she's in Cali. She's got a list of surgeons that do that take the time, that care about the aftercare, that refer out to her, that talk to her. So just because they do it one way in Miami doesn't mean that's the way they do it in the rest of the nation. And that's, I think, the biggest thing with explaining all of what Kathleen explained and like showing you guys the difference is we're just trying to be here to present you guys that like there is a different way. It's not just what everybody else is doing, because back in the 70s and the 80s and the 90s when all the rich people were getting facelifts, the world of post-op, the industry of post-op wasn't a thing. It was just MLD, and that was it. So it's been there. It's all out there. You guys just got to find it, and you got to choose what you want to do, because what may be right for one person isn't going to be right for the other person. What may be good post-op for one person isn't going to be post-op for a good candidate for the other person. Certain techniques, certain modalities, certain, care programs, certain like massage techniques, things like that aren't going to be what everybody wants. Is there science and proof that MLD works after surgery, like cancer surgery, like lipedema surgery, like facelifts, like all of that? Yes. Does it work with our clients, mine and Kathleen's? Yes. But guys, that may not be what you want. Maybe you don't want to do that. Maybe you want to go somewhere else and do body sculpting or whatever else, cupping, anything else that you want to do. And that's okay. And it has its place. But you got to be the one to decide that. We can't tell you whether it's right or wrong for you. You have to do the digging to figure out what sits right in your body and what makes sense for you and what you've tried that works and what you've tried that hasn't worked. Because a lot of my clients have tried all of the stuff. They've tried radio frequency. They've tried the lymph massage with oil and rubbing. They've tried, all the things. And they finally come to me at 6 months post-op with fibrosis. And when we get them on the Amare plan, we get them with proper lipo foams, we get them on the at-home care plan, we start with their proper Vater-style MLD. The same way with cancer patients, fibrosis is gone in a week. It's not just in this post-op world where fibrosis can be gotten rid of. They get rid of it in the cancer world every single day. Like PTs, OTs, everybody. So it's not like it's irreversible. It's just you have to figure out what path you want to go down for your body. That's it.
Absolutely. So the big thing that I do, and it's upside down. So this is my shortcut. I wrote a book and I give copies to each one of my clients. And I find that this has really helped because before I wrote the book, the people, their doctor kind of teased the whole thing up. It says, oh, Kathleen's expert, like whatever questions, just ask Kathleen. And then they would spend like 20 minutes. I saw like they wanted to relax and enjoy the massage, but like they had to pay attention because they had to ask me 20 questions. So it's been so much nicer to be able to give them the book. And then I also have, people were asking about what they should eat, what to eat before surgery, what to eat after surgery, and, what is out there that can help, to reduce swelling. And so that's why I wrote the Southern California Plastic Surgery Cookbook. giving people resources. Like, I think if you find the quality research and you find the quality resources as someone who's approaching having plastic surgery in the future, that will just help you, because it will give you that confidence that you kind of know what you're doing, and it will help you be more intelligent when you interview your therapist, to see if that therapist is really somebody that you want to work with. So my next question, unless you have a question, my next question that I wanted to talk about was our bold assertion that the issue isn't necessarily aggressive surgery, it's aggressive aftercare. And I had a conversation with you the other day, and it's like sometimes Ashley from Amare needs to like tell me things before I really think about it. And I do post-op massage for people who have liposuction with lipedema, and that is a large volume surgery. You're allowed to take more than 5 liters out. These are clients with a loose connective tissue disorder, where liposuction, because they have fibrosis in the fat, they need liposuction to remove that fibrofatty tissue. And I am able to use MLD and some post-op massage techniques and the right foams and garments to help them get a good result. And they don't get like this trash result, even though they've had like very aggressive surgery. So that has really, my conversation with you has kind of changed my viewpoint on that, because I've seen people with 5 liters of liposuction, we've been able to get them a result that they really like. You know, and again, like no one in my office has ever screamed out in pain, and no one is not rebooking because, you know, the massage is too painful. Like that, all my clients rebook, they say they enjoy, you know, their massages, and they enjoy having the conversation and learning from me. And I want it to be like educational. And if someone has like a level 9 out of 10 pain where they're screaming out loud, or anything over 4 or 5 level of pain, they are so focused on the pain, they can't be focused on getting, you know, asking questions. And then whatever education we have given ourselves as massage therapists, as post-op therapists, whatever advice that we could give them, like they can't take it. They can't ask the questions. They can't answer the questions because they're just so focused on the pain. So how do you see this, and what is your solution for clients? And so I'm real nice, ensconced here, like by the beach in San Diego with, you know, plastic surgeons that refer to me, but you're like on the front lines. You're taking people who have surgery in Miami. So what do you see, and how do you help them in the office, and what are your results?
So a lot of it is really just, again, like mental reprogramming. Like what I hear a lot is not so much that they're upset about how painful the massages were, it's the consent. That they didn't know that the therapist was going to stick them with a needle, that they didn't know that the therapist was going to cut open their incisions. And then it was painful, which just heightened everything. So, I mean, there is something to be said for being tender. I mean, with lipo, you guys don't come into my office earliest, depending on how much lipo you had, 48 hours. If you are still like on pain meds, cannot get up and drive yourself, you should not be coming into the office.
Yeah.
The end. That's with any surgery, that's the golden rule. If you are not coherent enough to get up and come into the office and drive to your appointment and get here, or have somebody drive you and have that person come into the room with you to help advocate for you and listen to all this information, you need to wait. We'll push your appointment. Let's give it a beat. Let's wait. Because it's not necessary, at least for us, to, you know, do all that, because we take a different approach. But with the trauma is what it is. It's the trauma from the treatment of the recovery houses, from being neglected by the surgeons, from being neglected by the massage therapists, and then the painful massages, that by the time they get to us, they're so broken, like spirit broken, as well as body broken from all the tissue damage and the surgery itself, of course, all of that trauma to the body, that we really, really try to get them to a place where, first of all, the minute I'm done with MLD, I stand up and I point out to them before I start and then after like, and I don't even have to 90% of the time, but where they went down, what it's supposed to feel like, what your body healing is supposed to feel like, what that process is supposed to be, because the surgeons aren't explaining it. So, you know, there's that part of it. I talked to them about, you know, the science of how fibrosis is created, like how it's supposed to be filtered through the body, how the lymphatic system filters proteins and like all of that stuff, and give them all this information, and it calms them down. And there's that whole part of it. Now, the biggest part of it is the at-home care. Guys, I can't go home with you. I'm sorry. Like, I can't yell at you to wear your Highland foams. I'm sorry. So the at-home care part of it, teaching them what parts of the arnica plant are a topical analgesic, not just random arnica that you're slathering on your body. What every ingredient is that you're using at home on your body, what it's doing to your body, how and when to use it. All of that stuff makes a bigger difference because you're actively taking care of yourself. And now if something goes wrong with your healing, if you have too much salt and your fibrosis starts coming back, you know, and you can stop and fix it and address it. And out of Miami, like Kathleen was saying, you know, it's a different, I deal with a different world of it. But out in Miami, they really just do nothing. They really don't. And more than do nothing, the way that tons of clients have told me how they get treated, they literally get their surgery and then get sent on a plane and kicked out. And that's it. Or sent to a recovery house and dropped on their ass. And that's it. And that's when you were, you know, when we were talking and I told you it's not the aggressive surgery, it's the aggressive aftercare. It's all of that compacted that you start making silly mistakes. And because, you know, you're so like freaked out already by everything. But I mean, yeah, I've done, you know, the lipedema removal surgeries, 4 different rounds back to back, 3 months in a row, super aggressive. Yeah. Traditional lipo, super aggressive, as well as full-blown mommy makeovers. I mean, breast augmentation with implants, lift and implants, internal ab repair, hernia repair, and a tummy tuck with a BBL and liposuction to the back and thigh lipo. That was like the biggest one. And with her, it was 12 to 15 sessions. We spaced them out a little bit. And her biggest part, again, was the at-home care because your body still needs to heal. You can get a million massages. If the healing isn't happening at home, if you're not using the proper aftercare products and buying random foams on Amazon, not knowing the science of why to even wear foams, it's not going to work. And you're not going to commit to it because you don't really get it. And then all that healing, I can do an MLD massage. You can be super tiny and then put yourself in the wrong faja or have too much salt or not drink enough water. And it's all down the drain. You can go to the best body contouring specialist and then, you know, do something silly that they tell you not to do. And it's all for nothing. Like if you color your hair and then use the wrong shampoo and boop, it's gone. You got to take care of it at home the same way, which is why we just developed the Amare protocol, because we noticed that a lot of people from Miami would just come in and get the massages, but they were so brainwashed from Miami, from the surgeons telling them to do things like cut their incisions open at home and didn't understand why it wasn't working. So then I started asking questions like, what were you told? Let me see your aftercare sheets. Let me see your discharge papers. What do you have? Give me anything you have. Let's see where you are. And then let's explain to you what we need to do to get you, you know, to start taking care of yourself at home and really healing and really like dealing with that part of it, because that's a part of the brainwashing trauma too, unfortunately. And it's not just Miami. It's New York too. It's New Jersey. It's all over. I don't want to just pinpoint Miami because there are a lot, and this isn't just like just post-op people. This isn't just like massage therapists. There are a lot of surgeons too that don't know what to do, so they tell them kind of whatever, and then the client interprets it in a certain way and starts making silly mistakes. So it's not just like, don't expect that just because you had plastic surgery, you're going to have fibrosis. It happens in every human that's ever had surgery. Swelling, fibrosis, complications. It happens in every human. The reason it happens less in the lipedema, lymphedema community is because they have us to teach them and take care of it. And the surgeons and the doctors and the oncology people know that MLD is something that is a medical modality and works for this. And these CLTs are trained to handle this. In the post-op world, that like medical backing isn't there yet. Well, I mean, with MLD it is, but the surgeons still don't really get it because it's all elective to them, and it's all like, you'll be fine. And then you're like, I don't really think I'm fine. I'm gonna go get some help. So that's why I developed this whole side of it, because out here it is no man's land. You guys are on your own, which really is terrible.
Yeah, yeah. So we had a comment, someone wanted to talk about fibrosis, so I definitely want to show. So this is, so MLD, if you have a raging case of fibrosis, I think we can all agree, one, it's not just MLD. You cannot just get an MLD, and this is the same thing with lymphedema. You cannot just get an MLD session and just put on a sundress and no faja and go home and then come back the next day and eat whatever you want and then come back the next day and just rely only on MLD. So maybe I'll do like 90% of my session, the very first session is MLD. And then as we get farther down through inflammatory to proliferative, I'm doing MLD in the beginning and at the end, and I'm putting in the middle post-op massage techniques that I show in my classes, fibrosis massage techniques that I show in my classes. So if it's just MLD, like just self MLD that you're doing and you're not compressing and you're not using foam, you're not going to get the result that you would get. And how do we know that? Because we see it in lymphedema. So there's more open cell foam and more closed cell foam. So the most open cell foam, if I could explain, like if you have an attic and you have some foam up there in the attic of your house, that's more open cell. Like they can even like shoot it out, right? And then there's something that's very much closed cell. So this is Comprex, and we use this stuff. It's from Germany. So these are some German foams that we would use to reduce and soften fibrosis for a client that had lymphedema. So we're taking this from our lymphedema world and helping clients after plastic surgery with it. So what I'm super popular for using this is if you have any like patch that's hard, we'll try to put this under your faja, under your other foam. If you have, if you get swelling like right around the belly button from liposuction, because it's hard to get the cannula right in and around to remove all that fat from the belly button. I have a surgeon that saw this come in on one of his clients, and he bought it, and he put it right on, and this kind of gets where that belly button part is very, very flat. If you go into a lighter foam, so this is like more of a flat foam, and the lipo foam is more of a flat foam. Textured foam is really what we've seen gets results. This was started with in the Foldy Clinic by a therapist called Bernd Schneider, so it's properly called a Schneider pack, and we're just seeing different companies make different versions of the Schneider pack. So these are from Mobiderm, which is a European company. So this is more of, I call this small block. So these are small blocks of foam, and this is the large block. So if you have some fibrosis, it's right in the skin, like you see peau d'orange marking on the skin, you can really see that, like right in that dermis is the fibrosis. I will use this. And then if it's more deeper, like you see a lump and bump or an overall firmness, I'll use this underneath. To a client, everyone loves these, which you can see, like, look, I only have like a couple feet left. I have more on order. And I'll put this in a stockinette to protect their skin from the foam. And then I will put, and then they have their foam over it and their faja over it compressing. So what happens is this compresses into the skin and makes indents. And then as you're walking around, as you're moving, these little foam blocks are massaging you. This is part of the self-care that I give to my clients. I say, my hands are on you once or twice, 1 or 2 hours a week. The rest of the time, this foam is on you. And they have really, really seen how if they have hardness, this softens it up. And so that's one of the questions, like experiencing hardness. So hardness is not necessarily fibrosis. You can definitely get hard. If I see hardness and it's a week or two, that's my signal. You need more manual lymphatic drainage. We need to move that hardness out. And I have seen under my hands, this is my hands, I have 135 hours MLD class after my 40 hours MLD class. I can move and I'll feel the hardness of the client in the beginning of the session. And then by the end of that MLD segment of the session, it will be softer. You can soften that up. And as it softens up, it goes into your lymphatic system, and then you urinate it out. This is how we get this hardness softening. My frustration is if people are having this hardness and they're not getting Vater style MLD or another style that's equally good MLD, because I know there's some Casely Smith, there's some Leduc people here, some Chickley people. Like, if you don't get a massage that's focused on moving that into your lymphatic system, I would want you to do that before I would want you to go to body sculpting. That's it. So that is how I have used my education as a certified lymphedema therapist to help people with fibrosis. I hope that has answered your question. While I was talking, I wasn't able to actually see the comments. So do you want to talk a little bit about clients? Like,
yes.
Conversation?
So yes, the original reason for all of this. Really quick to answer that, because I did see it scrolling through all of the questions. Our Amare Lipo Foams are 8x11 sheets. They are designed off of the exact foams that open cell, closed cell that you were talking about. I designed these off of the lymphedema foams, because getting the lymphedema foams for my clients, because I do see such a high volume of clients, was so expensive. So I would have to pay for it, and then they would have to pay on top of that for shipping and everything else. And by the time we got them and run out of stock and had to order more, it was just so much. So the same foam, the polyurethane foam that's in a chip sleeve that they use, that's in those little massagey things, this is a sheet of polyurethane foam. This is fully machine washable. It is completely flexible, just like yours, and it does the same exact thing. So when it's against your skin and you're moving, it creates a micro massage against your skin, the same way that your manual lymphatic drainage sessions do. And it helps to kind of work a way down the fibrosis. Yes, exactly. Yep. So it works down the fibrosis, turns it back into like a lymph fluid state. So when you get your MLD massages, you pee out that fluid that used to be fibrosis. That's how you get rid of fibrosis. Those are in our online shop if you're interested. And I have a whole big video on the science of the foams, and I'm doing another one next week. But ours come in a 3-pack of a sheet like this, and it's an 8x11 sheet, and you put it right into your garment. In the video, I explain everything. But I designed these specifically for lipo for that reason, because the lymphedema treatment, I couldn't find anything that was big enough to encompass a full body lipo 360 and be reused. My biggest thing that I love, my lipedema surgery people will buy 2 packs of foam, 6 sheets, and we can cut it around their limb, custom cut it to them. They can wash and reuse it for years. The longest I've seen this used for, 6 different lipedema surgeries over the course of 3 years. She still has her original pack of foams, like the Amare foams, and they're still in great condition, because she washes them with our detergent, because it's made to be washed with specific, like, normal people medical grade detergent, or not medical grade, but disinfecty, all that great stuff. All that stuff's on the shop. You guys can go and check it out later. But that same foam is what we designed this off of, because I wasn't happy. I'm never happy with the things that I find. If it's not easily accessible to you guys, if it's not affordable to you guys, I'm not happy, and I'm going to do something about it. So that's kind of how the online shop started, for exactly that, for people who have questions like that, where it's like, you try the thing that they said it worked, but you didn't really know what you were trying. You just went for it, so you don't even know if it was the right MLD massages, like Kathleen was saying. There are different ways of doing it. So there's that. And the foam and the garment and all your supplies, those are things that we start like right away when I see you, and I usually see you like a week out. But that aftercare stuff, we always, and like the one that just scrolled through the comments just now, we always get questions. Well, when do I start? Now, yesterday, when you started surgery, because all of this stuff goes hand in hand. All of the lymphedema things, right? They start using the foam immediately. That's not something we wait on. And it's in conjunction with your MLD, because you're going to have that softening happening. You want to get that out as soon as possible. So as far as your supplies, your diet, your faja, your foams, like that stuff, yes, usually ask your surgeon, but where we are out here in no man's land, that's something you'd set up a virtual consult with me for if you're super concerned. Otherwise, if you feel like it's going to help, start now. And all that information is in the videos. So when you guys come sliding in the DMs, which is my segue into the client thing, when you come sliding into our DMs and comment sections asking us to give you medical advice, to give you, well, when can I stop wearing my faja? Well, my stomach looked like this. What should I do? Guys, I don't know who you are. I can't tell you. I don't know your situation. I can't give you medical advice. I can tell you your foams can be started with your garment. Our foams are meant to buffer the hot spots in the garment to stop the impingement of lymphatic fluid so that you have consistent flow in your body to help get your swelling down and maintain you in between your massages, whether it's every day in a row, consecutive like with us, or every 2 days, or every like twice a week, or even if you can only get in once a week. That's what we use it for. But I can't give you, I don't know when your surgery was, who your doctor was, what you had done, how much you had done, what your recovery was like, how you've been taking care of it at home, what it feels like, what it looks like. You say you did MLD, but like, what did you do? You say you got massages and like 30 of them, but like, what does that mean? Like, have you been having salt? Like, what have you been doing anything your surgeon told you? Did your surgeon even tell you to do anything? So I can't, liability-wise, professionally, license-wise, you do anything, really, give you anything until we actually see you and talk to you. Because we don't even know how to answer your questions properly until we actually get the backstory of what's going on and figure out where in your healing timeline are you. Not how many days are you out from surgery, because that doesn't mean anything if all the bad things have been happening to you. But where are you in your healing, at what point, and what problems do we need to address and correct the way you've been doing things. That's why you can't just message us. And that's why I have an automated message that goes out whenever you guys like send pictures or whatever that you're sending. It's an automated message, tells you to call the office, says it's a question for Ashley. Because I have lots of videos explaining lots of science things, explaining lots of techniques, the same way Kathleen does. But that's general information. You can, honestly, guys, if you tried hard enough, you could find that same information on Google. If you looked, you could read the same medical journals that I read, because that's where I get it all from, is all the medical journals. It's all right out there for you. But you got to look. And you got to know what to look for. And you got to actually talk to us face to face, because we don't know who you are. And I know the reason you guys get into that habit is because of the Miami mentality, right? That's what I like to call it. It's not just Miami, but it's the Miami mentality, where doctors are telling you to slide in their DMs. Recovery houses are telling you to WhatsApp them. Post-op nurses, that's a different situation. They mostly tell you to. But even massage therapists, like, they don't tell you to call the office. They tell you to slide in a DM or a WhatsApp. Like, that's where this starts, is that you guys are used to that. So then when it's someone like me or Kathleen, who are all like sciencey and like want to know everything about you before we do anything to try and help you, you get real mad that we don't respond to a DM. Or you get real mad when you text the line, the office number, and nobody answers or tells you to call the office because we don't know who you are. Like, it's the same way you, and I can't even say your surgeon, because I know a lot of patient care coordinators that will just do the whole thing through DM with you, or do the whole thing through WhatsApp with you. And you're like, oh, okay. But if you had a neurological condition, you would not DM your neurologist. You might text them if it's an emergency. You might call them if it's an emergency, but you're not going to DM your neurologist or your oncologist. You're not going to DM them. You're not going to WhatsApp them. And it's, you guys get into that habit because that's the way they're telling you to treat them. So then you treat us that way. And that's where that comes from. But no, we're not going to, I'm sorry, I can't. I can't. There's no way.
Absolutely. So we had a comment that says she feels this is misleading because her fibrosis hurt even with massages because her skin felt like it was ripping apart. So I what would I say? Like, I want to know if you had manual lymphatic drainage. I want to know how she prepared you before you had it. Like I said, you know what? Like what you just said, like, we can't give a lot of advice over like one sentence. We need to know all the things that Ashley just said. um, because people can have different experiences post-op. And it is what I want to do as a therapist is to get a client into my office and give them the best results with the least amount of pain. And if you are having pain with your post-op massage, I am going to alter what I am doing to get you the best results. Maybe it takes me longer to do everything. And I've definitely, since I had a facelift, I used to be like a little bit like the massaging with the facelift. And then I had a facelift and I felt in my body how painful it is to have like some kind of brisk massage after facelift. And now I feel like I'm much better a therapist because I've had the plastic surgery, and my MLD is absolutely on point at like 1 second each stroke, because that is what my body is able to receive. And so my theory that I work with is like I want to give the treatment that your body is able to accept and receive. I can't give you too fast. Like if I'm drinking a glass of water, I can drink it, but if I like throw it on my head, all it is my head is wet and nothing's going into my mouth. So that is my theory that I take into the that's my theory that I take into the room, that I want to help myself give the best experience for my client, because I'm well trained enough. I didn't just take one weekend class and I only know one way to do it. And if it hurts while I'm doing it, you know, like, well, I just had 15 hours. All I can do is give you a cookie cutter massage. Like, you know, like, I'm sorry it hurts, but this is the only way I was trained. When you get years and years of training and understand different ways that you can help the client, and you are trained enough that you can use your creativity and say, oh, like something's here in lymphedema's world is working. Like, let's try it out in post-op world. And that's how I am able to get the best results with my client. That's why I picked up a cup and took a cupping class. And now I do fibrosis cupping as part of the post-op massage for my clients. And I was just able to get such results and overnight results where I was emailing the guy the next day and he said, oh my gosh, Kathleen, such a difference in my lower abdomen. Like the combination of having, like, getting them to put the right compression on, getting them to put a foam on over the compression, and doing some cupping really helped to reduce that fibrosis to the point where his healing was back on track.
Yeah, and I think this is the thing with anybody in pain, right? Because I started, like I said, in the cancer, fibro, Lyme, autoimmune disease community. I have an issue like that where once every like 5 years I have an attack and I'm on the floor crying in pain because I can barely breathe. I just had one like a couple months ago and I hadn't had one in 5 years and it was debilitating. I've had it my whole life to the point where I can't walk for weeks. And it was really bad when I was younger. And through holistic health and nutrition and all this stuff, like I fixed it and figured it out. Every once in a while, when I'm not sleeping, not eating, you know, doing too much, my body hates me. And I can usually feel it because my skin is so sensitive, even the wind hurts. And I live like that all the time. So I understand that whole like pain thing, because some people like myself, like fibro, like Lyme, are so beyond sensitive to touch, to just any touch. So that's why I became obsessed with MLD, because it helped me so much, especially when I have those attacks where it's called porphyria. It's a rare blood disease, blah, blah, blah. You guys can look it up, but it sucks. And it's super manageable, but completely not treatable. There is no cure for it. And it's the MLD that helps calm down the nervous system to stop the pain cycle that I'm having, and then also get rid of the swelling. So that's why I became in love with the MLD thing and the gentle touch thing. But that's also why I say I also know that pain. I live with that pain, and I don't know if it's going to get worse as I get older. There is like no research on it. So for me, when it comes to the pain scale thing and like clients being in pain and using different modalities in different ways, like I tell them, I would rather you stay home and rest. Like your massages can wait. We can get the swelling out later. It's going to be okay. But the most important thing is that you're healing so that we can get you in. Because even if that nickel pressure, so the pressure of a nickel, literally putting a nickel on your skin, that's the pressure of manual lymphatic drainage massage, in case you guys are wondering. So just drop a nickel on your skin and slide the nickel around. That's how light manual lymphatic drainage is. That's the exact pressure. So even that for me, there are days where that is way too much. And on those days, stay home, rest until your body is capable of doing that. And then as you heal, you're going to be less sensitive, and you can get MLD, and you can get the cupping, and you can get, body contouring techniques if you so wish, and all of that. So that pain perception, pain scale thing, a lot of it is you need to really know your body with it. And yeah, you need to be able as a therapist to have gone through something like Kathleen and I have gone through to really understand what that pain level is. Because when there is no doctor that knows what the hell porphyria is and can't help you, when you go to the emergency room and they look at you like you're crazy and you're on the floor crying for hours and days, and they keep you only to discharge you, and you're in more pain because of the drugs they pumped into you, that same mistreatment there is akin to the ones in Miami. And then you go home and you're still lost and confused and in pain and freaking out, and it makes your pain worse. Mm-hmm. So stay home, rest, give it a sec, but also as a therapist, knowing what to use for your clients, whether it's the gentle MLD, whether it's body contouring, whether it's cupping for fibrosis, lipo foams, garment, at-home care, whatever's missing, having all of those other modalities from being a lymphatic therapist, from having my experiences, from being in that medical side of the field and knowing all of that is really what you're able to do for your clients more in this post-op world. Anybody who's dealing with swelling or pain or surgery or healing. That's really where all of that comes in. So that's just my little insert in there on this side of the world.
Wonderful, wonderful. Yeah, so we've had a bunch of questions, and I wanted to let you finish. So
yeah.
First of all, the very one I see right now, Ty hits it on the head. Body contouring shouldn't be used on plastic surgery clients. I hope we can all agree on that.
Yeah.
We asked about classes that we've taken. So I just attended and spoke at a very great conference on lipedema, the FGRS conference. That's really great. And then several surgeons spoke about the surgical technique. And I got to go into the surgery, into the Cleveland Clinic and watch surgery, watch lipedema, watch lymphedema liposuction, and what other classes I really like. Close has a bunch of great classes. They have classes at breast cancer for after breast cancer. Jody Winnicore does a really great class. So Ty commented that lipedema is not post-op. What we're talking about is the client with lipedema will get liposuction. They will get liposuction, usually it's large volume liposuction. They will get, as Ashley was saying, they will get liposuction in several stages. So sometimes they'll do one leg at a time. Sometimes they'll do both legs, but the front of them, and then both legs, but the back of them. So I have two plastic surgeons from LA that refer their clients who live locally who get this liposuction, specialized liposuction after lipedema. And we talked, Ashley and I talked earlier about the importance of, as we lead this industry forward, more and more massage therapists should get into publishing research in peer-reviewed journals. So I am honored to be a co-author in the Standard of Care for Lipedema in the United States paper, which is about 1 year old today. This week is our 1 year anniversary of publishing that paper. In the journal Phlebology, where we have an entire section in the peer-reviewed journal talking about the post-op care for this specific type of liposuction for a client with lipedema.
I also just want to say that it's not just the lipedema. So the client that I had 6 rounds. So she had her first 3 rounds in 1 year, first 3 rounds in the other year. So it was bottom half of her legs, front and back, top half of her legs, front and back, and then again, and then the sides. And then she got a leg, Jesus, thigh lift. That's what I was trying to say, from all of the skin to help close that interstitial space so she doesn't have that swelling rebound again. So she had a double thigh lift on both sides all the way up like to almost her inguinals. They were managed to save that, thank God, that whole pathway. But she has that as well. And then as her body started healing, she then got a body lift as well. So all of that plastic surgery, just because that's what I call medically necessary plastic surgery, not just cosmetic plastic surgery. That's a big thing there. But they go through all of these, surgeries to help heal the problem. Now, I think Ty did say she's curious about what post-op training we've had. With my MLD training, my original VODR MLD training, because Elisa DeFalco works in the surgeries with Dr. Rademacher, she actually had several of them. And I've actually worked with her in the post-op stuff for MLD with the Dr. Rademacher situation. In my MLD masters, they had 2 classes on post-op and MLD as far as the whole using the foams for fibrosis, the same way they do with lipedema and lymphedema treatment, as well as the Hollywood Med Spa MLD class, which talks about how she's been in the OR with Rademacher, and she created the post-op training to show how you can help with the swelling after surgery, when you should start, how many sessions they need, when is it indicated, when is it contraindicated, the effects of MLD on the body after surgery, good and bad, or, risky or not, things like that, what surgeries benefit more from it than others, how long you can go without it, when you should start, all of that. So my post-op training has been there since day one, as well as then the lipedema and lymphedema training, which talks about post-operative care with MLD for your clients after they get the lipedema surgery removed. So they do teach MLD-based post-op classes for MLD, but that is different than a post-op class that teaches something for plastic surgery that's kind of cosmetic, I would say, or like Lipo 360, BBL, things like that aren't medically necessary when we're dealing with a lymph problem to begin with, or a cancer problem, because she did teach the MLD for after cancer stuff like that. So there is a lot of in the OR post-op exposure with MLD that I've learned from, seen. She's taught case studies that she's brought in to class for us that have been, post-surgery people that we've, dealt with. So it is different than the post-op world now. Again, I did it 7 years ago, but it's also more MLD based. It's all MLD based, actually. It's an MLD post-op training to treat those lipedema, lymphedema post-op people.
So I think there's an important question, and I see your question. So the idea is, like, where are we getting the techniques that we have for post-op massage and fibrosis massage? That's an important question to answer, because we've been talking a lot about MLD, but and when I talk about what I do with clients, I say I'm only like 100% MLD that very first session, and then I'm switching into post-op and switching to fibrosis. When you get your training as a certified lymphedema therapist, what we don't call it fibrosis massage, we call it deeper techniques, at least my teacher did in close. So that's something you can hear and something you can like ask for deeper techniques. And then the PT will, my instructors were all physical therapists, they will show you that. So when I was talking about the breast cancer class by Jody Winnicor, so this is first you get your CLT, like first you get your MT, OT, PT, and then you go through the CLT training, and then these other trainings are opened up to you. Sometimes you have to have the CLT, sometimes you don't. So this is how we treat fibrosis after breast cancer, after mastectomy and reconstruction, after radiation and chemotherapy. So these are much more what your physical therapist friend will call manual techniques. When you get into going to a conference like the National Lymphedema Network Conference, which is happening this fall at the Cleveland Clinic again, I would highly recommend, if you have education in lymphedema, to go to these conferences, because then you can go into a 1 hour, a 3-hour class, like a breakout class, where they actually show hands-on fibrosis techniques. the person that I learned a lot of fibrosis techniques. None of this is me. None of this is like, I thought up this is my magical thing, it's all covered. Like, all of this is widespread where we come from, and we're just bringing it into a different area. The person I follow and I've learned so much for, she's an OT, she's in California, her name's Karen Ashforth, and she teaches these classes at the conferences. So that in America is where you would get a lot of this ongoing education, and you can go to the conferences year after year and follow the teachers that are getting the new techniques, and they're showing you as the surgery world changes, as their techniques are getting better, you can learn new things at each conference. The other thing I thought I saw, which I thought was interesting, is they said, but it's not post-op care for plastic surgery, BBL, tummy tucks. That's very interesting to me, because I had a plastic surgeon friend of mine re-educate me on the fact that if I'm talking about cosmetic surgery, I need to talk about cosmetic surgery. But I've had a lot of plastic surgery. I had a rhinoplasty, I had a facelift, I had a neck lift, I had a brow lift, but I had liposuction with fat transfer. But I've also had a cheek reconstruction with a plate and some pins in it. That's also plastic surgery. I also had cancer surgery right here, Mohs, to remove some skin cancer. That was also done by a plastic surgeon. And I think that's, and one of the plastic surgeons that refers me, most of the clients he refers, is breast cancer reconstruction with autologous fat transfer to the breast. And it's very important to know that if you are, just as I say, if someone puts lymphatic massage and they're an MLD and they have 40 hours and they put it on their website, they are going to get a client that has lymphedema, they're going to get a client that has a tummy tuck, and they want to know if they can help them. Same thing, if you start advertising, and this is just my opinion, if you start advertising that you can take care of someone after plastic surgery, you need to be prepared that someone with a facelift is going to think that you mean them. Plastic surgery is much more than just Brazilian butt lifts and tummy tucks. But I will say for tummy tucks, mostly MLD, a little bit of myofascial work, no cupping until at least 3 months because of the feature of the tummy tuck. But Brazilian butt lift, I'm definitely doing fibrosis cupping, the myofascial work. All this is covered in my classes. If you want to know, if you really, really like, Kathleen, why are you only talking about MLD on here? Because there's a complete line of classes that you can take. And it's not just me, it's several teachers, and there's several teachers who teach this post-op massage techniques that are on this live, and you can benefit from learning from each and every one of us. So the other question, which I had tagged down here, because I want to answer her question, do you work on clients from Colombia or the DR? If so, is your treatment the same or different? So when I had clients from the DR, they would come to me, and they come to me like 2 weeks, at least a week after their surgery, because it takes, they've had massages in the DR and in Colombia, and when they come back, they're like more than a week out. So what I'm doing is, like, it depends. Sometimes I do see a lot of firmness, so I'm using more post-op massage techniques. But I always start and end every session with MLD, and they definitely benefit from the foams. I also would get clients from Tijuana before the pandemic, when I accepted clients who were coming here. So we got a lot of overseas and international clients, just because I'm from San Diego, we get a lot of that, as well as local clients. And then I have clients, she is Colombian, but she got her plastic surgery here. Very interesting, because she has a different, she wants different results than I think her doctor thinks she wants. And I think it's because she's Colombian. She is used to a different standard of beauty in her country. And so we are getting her there. So maybe if you saw, like, the average client, if you saw her on paper, you'd think that I would do a different type of massage, but it's the interaction with the client. And that was also a question that was asked, like, who's in charge of saying what the results are and the goals are, and it's always the client. And I see, and the goals at 2 weeks are, maybe they're different than the goals at 5 weeks and the goals at 8 weeks, but that's how you have to, every time you see the client, you check in with them again And then that's how I reinforce the home care. Because if they feel like, like, oh, like I had a party and I was out of my faja, and it's like, well, tell me again what your goal is. And it's a little bit of motivational interviewing so they can convince themselves to get back in their faja and do their foams and do their routine and do what they know is right for them in between this session and their next session. But I'll go ahead and let you answer the question too.
I think the treatment, like you said, they do expect different results. And I mean, I talk about this all the time. When you go to your surgeon and you tell them what you want, you got to tell them what you want. Don't tell them you want a BBL and Lipo 360. Pinch your body and show them what you want so that they understand. Because his BBL or hers, the doctor, in their head is different than what you have in your head. So wish pics are always helpful. Actually physically showing them where you want places and things done, put where, is also super helpful. Because again, there's that disconnect. And I find that it even not just the whole like Colombian body beauty culture thing, but here too, just regular mommies that want to look good, and then they're like, oh, it's too big, I'm really upset. So yeah, there's that whole part of it as well that I totally agree with. The aftercare is definitely different. Like we know, they have different standards of care, like you said. The post-op massages are definitely different, but it doesn't mean that you can't get the same help. It's just gonna not be what you're used to. But you can still get your results and you can still get the same help that you want. And like you said about the plastic surgery thing, that's why I say medically necessary and cosmetic. Because cosmetic is Lipo 360, BBL, all of the cosmetic stuff, whereas medically necessary would be, and I mean, lipedema kind of sits on that line because it is cosmetic, but it's also super necessary when you can't fit your feet in your shoes anymore and you can't wear pants and you can't even walk. So yeah, the thigh lift is kind of cosmetic that comes with that, but it's also medically necessary so that doesn't happen again. So it kind of falls into each other, because even with a tummy tuck, if you have really bad distension, it can be covered by insurance and then turns into medically necessary. Whereas if it's just loose skin, it's a tummy tuck without the ab repair, just a skin removal. So it really depends. It kind of goes hand in hand with that whole part of it. But I mean, plastic surgeons can be, like Dr. Rademacher, he's a plastic surgeon doing hand plastic surgery. So MLD for hand stuff. There's a lot of delicate tendons and things like that. So we don't want to be putting too much pressure or doing anything. So MLD would be indicated for that. Somebody who needs like Lipo 360 BBL stuff might want to do more post-op massage techniques like the things you were talking about, and MLD to help with the swelling. This is why in the beginning when we started talking, I said you have to decide what path you want to go. You have to figure out what you want to do and how you want to proceed with it as far as what your body's going to need for your aftercare, and listen to the people. Check out Ty's page, check out Kathleen's page, see what everybody's offering so that you have options and you don't just have to deem, post-op massage the most terrible thing in the world because it's painful or whatever. Again, pain scales are relative, techniques are relative, what you need is relative. Check them out, go to their pages, listen to what they have to say, get the information, and then decide what you want to do for your body on it. Because it's not what's right or wrong, it's what you need. There is no, this isn't just like a pigeonholed one size fits all. I think I saw a comment go by cookie cutter MLD. Yeah, there isn't just a one size fits all standard. Not everybody is going to get foams from me. Not everybody is getting the same at-home care plan from me. Not everybody is getting the same amount of sessions in the same amount of time on the same schedule from me. It depends on what your body needs. And that's why I've had people ask me, oh, you should franchise. And I'm like, why the hell would I do that? This is not that kind of industry. What is wrong with you? We are not massage envy out here. We work too damn hard for that to be massage envy or hand and stone. It's growing, it's changing. There's new information every day. Everybody's doing different things. So go learn. Check out all the pages. And if there's something maybe you want to try it, and then maybe try the other side of it and see if you like it and see if it helps for what you have going on. Maybe you've tried, the post-op massage road and it didn't work for you and you're 6 months out. You want to try the MLD road. Maybe you tried the MLD road and it didn't work and you want Kathleen to do some post-op massage techniques on you. It can go both ways and you can do all of it. There is no one way with Columbia versus New York versus Miami versus New Jersey. It's a whole big combination of tools that you have to help you in your recovery. In whatever form that is, just make sure you understand what you're getting done so you're not deeming it good or bad because you expected it to be something else that it wasn't. And that's another thing, like we're talking about the whole clients part of it. A lot of clients will get the post-op massage techniques a day after, like the day right after. And then they'll say, oh my God, it was so painful. I'm never going back. It was terrible. But that's because you didn't really know, kind of did it really soon. And it was too much for you. That doesn't mean it's the most evil thing on the planet. That just means you need some MLD before you do that, like Kathleen said. But that's just my whole thing on it. There really isn't a difference when it comes to Miami, Columbia, all of the surgeries, whether it's medically necessary or cosmetic, but you have this plethora of professionals. You have this plethora of training and schools and medical knowledge to learn from and to choose from. So like, use that. Go look for everything. Use that to your advantage and figure out what you guys need. It's not really, I know that like just because they do it one way in Columbia, they don't have all of these options, but we have so many options, which is so great for all the different types of clients. And as a therapist, you have to figure out what you want to offer and what you want to hone in on. Like I said, I started doing MLD for oncology, surgeries that are related to oncology, super aggressive, super intense surgeries with lots of complications, lots of lymphedema. And then the other end of the spectrum, which is the autoimmune disease, the Lyme, the cancer, the MS, fibromyalgia, postnatal, all of the other stuff with MLD. That's what we specialize in is MLD. Do I do cupping? Yes, when it's warranted. Do I do medical massage, NMT, myofascial release? Yeah, I do. When it's needed, wherever it's needed. We got to be able to switch it up when we need to and not just say like it's one thing or it's the other thing. It's all of it. And that's like the answering the question there between the Colombian and here.
Yeah, and I think there's some confusion, and I think people who, how should I say this, because I want to be delicate, like people who aren't really familiar with how it is want a cookie cutter answer, and they want to know like when do you do MLD and when do you not do MLD. And so let me be clear, because this question is getting answered, and I feel like I answered it twice, but it's getting asked, so I was not making myself clear enough. The first session, the first couple sessions, if I feel the skin, there's a lot of swelling, there's no firmness, they're not hard yet, I'm doing MLD. If someone is telling me, I feel the skin is firm. They feel the skin is firm. We're not talking about fibrosis yet. We're still in the first couple weeks. They're telling me they have a tightness, like it feels like taffy, pulling taffy. They have real range of motion, but it's just real tight getting there. They can't twist. They can't like bend. They can't tie their shoes. That's when I'm starting my post-op techniques. And I have an entire school. It has over 2,000 students. I do not teach manual lymphatic drainage. All I teach is post-op techniques, including fibrosis techniques, several different classes, several different ways for different surgeries. So I am going to incorporate some of those post-op techniques, and how I know it works and how the client knows that they got their money is they come in and they're tight. And they feel like they can't move, they're in pain, their skin is thick, and they go out of the massage and they're like, oh my gosh, like that felt good when you did it. I feel less tight, I feel more able to move around. And then when they come out of the room and they're dressed, they say, I am able to get my faja on the tighter hook. This is why I know what I'm doing works. And then they come back the next week. And so we give them the foam so they keep their result. And I make sure that faja is not too long in the torso, which is what we get a lot in California. And I make sure that they're able to have the right foams in the right place. So they're keeping those results. It's not that like, it looks good and it feels good that one day, but then when I email them the next day, they're like, oh yeah, like I lost everything. So it's not like that. I need to give them the massage that will help to improve their results, so they get that, like, one time it's 2 steps forward and 1 step back, but over the space of a couple weeks, they are finding that they're getting into that smaller faja that for 10 days, and they're getting into that second smaller faja in a couple weeks. And I want to keep that going. And if it's not going, then I want to ask them, what are they doing with their home care? Like Nurse DMV says, sometimes it's not just about the post-op. They need to hydrate, they need to eat right. And at that point where they're coming in, they're, the first thing I get someone in, the 3rd visit, the 4th visit, and they're like, you know what, I still have some soreness here. And I was like, how's your faja feeling? And then, they're like, well, full confession, like I went out and I didn't, drink all the water and blah, 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 whatever it is. But this is their option. Every time they come to us, it's their chance to reset. They get that comfortable massage. They feel like they're back into their faja, and then they're going to do everything that they know they need to do to get their result. And the final result is always, always in the client's hands. When they see that they're naked in the mirror and they're like, hot damn, I love my result. That's when you stop wearing the faja. That's, when you start weaning off the faja, that's when we need to see if you maybe need less massages, every month. And so that it's always, the result is always in the client's hands. And you have to know that, because we're in this Instagram reality where a lot of these before and afters are photoshopped, frankly, from the client's perspective. When you see someone who's had a lot of plastic surgery and she's showing off, like, you can't just take that to the doctor and say, you know what, this is my ideal body, because you have to understand that, like, I've seen it with my own eyes. It doesn't matter how many surgeries they have, they're still doing a little bit of Photoshop to that picture. So you have to have a realistic idea of what your before and after is going to be. And then you have to have, the Nurse DMV says Photoshop. You cannot compete with Photoshop. But on the flip side, not all people want to look like the before and after. That's the massively snatched person. Here in California, not everyone wants the same size ass that they get from their Brazilian butt lift. And we have to meet the clients where they are, and you have to really listen to them and give them the results that they want, and not, overtreat them or try to like sell them into something different than what they ideally want. Because some people absolutely, they need to get into the bikini, and some people are like, you know what, it's amazing. All I wanted to do is get rid of that little pooch that I've had since I had my 2 kids. And if they're feeling amazing and they feel like they've gotten a great result and they want to know when to take their faja off, I don't think we're doing the right thing as therapists by being like, oh no, I can snatch you like 2 sizes smaller. Like, you need to keep that faja on for 6 months. Because the people will come and they'll be like, I got 1 liter of liposuction. Do I really need to wear a faja for 6 months? And I will tell them, the plastic surgery stories you hear on the Instagram are not all exactly what's going to happen to you, because a lot of these ladies are having 5 liters of liposuction, and it's not going to be the same recovery for you, because they're scared. They have that deer in the headlights look, and they're like, oh my God, am I really going to have to go to 20 massages with you and wear 8 fajas? And I was like, you know what, the client is always in charge of the care experience. Like, the client is the one that gets to decide when they want the result to be, and what they want the result to be, and how far they want to go in order to achieve it. It's not me pushing a client.
And I agree with that too. Like, I mean, like I told you last night, and I say in all my videos, and I've been saying for years, recovery is your responsibility. Point blank. Again, choosing what you do to recover, how fast you recover, the information you get to recover, your at-home care, which is like the biggest part of all of it, because nothing else matters if you're not doing that. I had a client who came in, she had 3 sessions, she had like a package, she was happy, she was like going through everything, she was motivated, she was shrinking like crazy. She goes, I don't understand why I have to do all this because my friend got lipo or my friend had surgery and she didn't need any massages. So why is my body like this? Like shaming herself for needing to take care of herself. And I was like, well, what did she have done? And she was like, oh, well, she just had lipo. This woman had lipo, tummy tuck, and BBL. And was in a recovery house. And had more damage from the squeeze massages. And was anemic. So there was that issue. And had an infection. And is now starting her massages 7 weeks out. And I'm like, okay, let me ask you, how many liters of lipo did she get done? She was like, oh, it was only like 1 or 2.
Mm-hmm.
I was like, okay. And she was like, well, she was only in her faja for like 2 or 3 weeks and then she was like gone. And I'm like, okay, but that's not you, babe. Like, you need a little more love. Like, you had a lot of surgery done. Your surgery journey, your recovery journey is not going to be anybody else's. If I had to have, like, if I chose to have a plastic surgery, if I had surgery before, if I had to choose to have a plastic surgery, I honestly don't know that I could with my condition. My body doesn't produce heme iron, like the protein heme for my iron. I don't know that I'd be able to survive that. Like, I have enough problems. My recovery would be extensive and I would be doing everything, all the massages, everything and anything I needed to. My recovery is going to be different than your facelift is going to be different than somebody's lipo and BBL. Even if 2 people both get a liter of lipo taken out from the same surgeon at the same time, their healing is going to be completely different because how you treat your body is different from how they treat their body. How you're taking care of yourself after surgery is how they're taking care of themselves after surgery, and it's different. How your body heals is going to be different than how somebody else's body heals. What massages you need are going to be different from the massages that they need, and you're not going to heal at the same rates, and you're not going to heal at the same time. You guys are different people with different bodies, completely unique and individualized. So you can't, and I think the best thing I love is everybody knows I talk about Jocelyn all the time. Jocelyn is one of my clients who I love. She's great. Jocelyn walked into, like, boss ass move, walked into her doctor's office. She brought her own, like, a photo of herself from 4 years ago. She's like, here's my wish pick. Make it happen. I was like, oh, that is some self-confidence, woman. Jesus Lord. How many of you guys do that? How many of you guys find a photo that you loved the way you looked and bring it to your doctor's office? Even if it's a photo where, like, you're in a Spanx or in a girdle, where you may not have been happy with your body, but that photo looks good. That's more realistic than something photoshopped on Instagram. Or just showing them a picture of you, or like I said, walk up in there and be like, this, gotta go. Get it off, whatever we gotta do, and let them tell you what they can do for you. You guys are hiring a surgeon. The same way you're hiring someone for your aftercare. You're hiring a surgeon. Let them tell you what they can do for you and how they can take care of you. But yeah, this is, you gotta be focused on you in this process to make the right decisions. And the aftercare and the recovery and the surgery and even down to the wish pick, it's about you, baby girl. It's all about you. This should be like buying a Mercedes. This should be like walking up into the dealership and being like, hey, I'm about to do some shit and drop some money on your desk real quick. You should come and help me. And this is what I want because this is what I want and this is what I deserve because I'm doing this for me. So I'm going to need some help. Like, that's what this should feel like. And if they tell you, because you have in your head that you want Lipo 360 and BBL, and if they tell you, well, we can't do that, you're going to get real upset. But if you go in there and you say, hey, this is how I want to look, what's the best way I could get there? And they'll give you your options. Now, again, like with Kathleen, she went in for a little thing and they were like, no, you're not going to be happy with that. We need to do this instead. It may also be the reverse. You may walk in there and being like, I want a nice BBL, but I have almost no fat to take out. Maybe you can't do that right now. Maybe you wait. Maybe there are medical issues that stop you from having your surgery. You got to be okay with that too, because again, this isn't a straight line. It's your journey. Journeys are never a straight line. It's how you get to where you want to get to. And maybe instead of a BBL, you do implants. They have butt implants. Maybe instead of doing, breast implants, you do a fat transfer to the breasts to give you curve instead of projection. There are tons of different options. There are so many surgeons that specialize in so many different crazy techniques nowadays that your healing is going to need different things for. Not just MLD, MLD and post-op massage and all these other things to help you along the way, because the techniques are different to get you where you want to go. It's so much more customizable. Yeah, no, none of those. We have enough of those butt injection stories. That's why I didn't say that, because that's not, no, it's a hot mess. We don't want that. But there are so many different things out there now that by you guys saying in your little Instagram, this is the way box, and getting mad about everything else, you're pigeonholing your results. You're pigeonholing your recovery, and you're pigeonholing yourself, because there is so much more out there. There's so much more out there for surgeons, for surgery options, for non-surgical options like M-Sculpt, for post-op massage, for MLD, for all these different things. There's so much more out there for what you need. So don't just go based off before and afters on Instagram when you're picking a therapist or a doctor. That's my little word to the wise.
That's good. Good. So I want to give 2 tips, because I know the question has been asked several times, like, what is our education? What kind of education do you get for this? What do you do? So like Ashley said, like, first principles, first turn to the literature, and go ahead and read the literature. That's what I base a lot of my classes on. When I want to teach a class, when I want to learn something new, you go to the peer-reviewed plastic surgery journals. There's a great PRS, Plastic and Reconstructive Surgery Journal, has a global open section. So it's called PRS Go. And is a free, every month when they release the PRS Go journal, it's open source. So you can read all of these articles. That would be really great first free education. And then if you follow me on Facebook, I take the articles that I like, I put them on my Facebook. I take articles that pertain to what's in my classes, and I put them in the comments section of my online classes. So as you take that online class, you're exposed to the latest journal articles, because like if you took class 10 years ago, like surgery's changed since then. Absolutely. You always need to be up to date. The other thing, a lot of people are like, oh, Kathleen, like if you follow me on Instagram, all these webinars, like you're always taking pictures of these webinars. How do you find your webinars? Which webinars have you gone to? So some of them are still online. If you go to my website, my business website, in the plastic surgeon section, because I have a section that plastic surgeons can read on my business website, it has a link where you could see the latest update of my resume. And I've done the resume where you can see my big education. Like I didn't even say before, like I graduated summa cum laude from Siena Heights University with a bachelor's degree in massage therapy. And I have like behind me a health coach, personal trainer. All that stuff there is on the resume. All of this has informed the way I am able to give advice to clients, of staying always within our scope of practice as massage therapists. But if you wanted to kind of get an idea of like, where does Kathleen get what is she thinking about? What is she exposing herself to? You can see that. The other thing was like, people want to know how you become a certified compression fitter. So what you do is you get your CLT, and after you get your CLT, these additional classes are opened up to you. And so you'll be able to register with Sigvaris, with Medi, Juzo, and get their class, and they'll get you to the classes. So this was the most fantastic thing. This and lymphedema seminars, the certified fitter class and the lymphedema seminars class. If you are a CLT and you want to take cash pay people who are needing lymphedema care, go to the certified fitters. Then you can see the other CLTs in your area that work at hospitals, and then they can see who you are, and then you can give them your cards. And if they have a client that's out because they don't have any more PT visits, or for whatever reason they want someone to come to their house to deliver the services, and you are a CLT, like that is where I would meet people at the in-person certified fitter classes. And then also you get to see all these foams and stuff. Like I was at a conference like 4 years ago, and I saw there was a guy who was showing Mobiderm, and it was the first time he was bringing it to America. And I just like grabbed it and I said, I need this. Like, when is it ever coming to this country? So going to conferences, going to these certified fitter classes, going to lymphedema seminars. And when lymphedema seminars, we're having one in October in Palm Springs. This is where you can see all the CLTs from the entire region. So if you're trying to get an introduction to a certified lymphedema therapist at a hospital to get those referrals, that is where I would go. I would go to lymphedema seminars. They're starting one. The one that's closest to me is Palm Springs. That's where I had to drive all the way up to Palm Springs to meet someone from San Diego and to give them my cards. And it's like, they know, as a massage therapist, like they know we're out there. They're not really sure. And when the CLT that's at a hospital sees that you care enough, that you're going and taking your education seriously, then they're going to be like, oh, okay. And then they see you're legit, like they can go onto your website and they can see that you have an office, and then they can see that your resume is on point and you're always educating yourself. Then you can get these very valuable referrals for people who need ongoing lymphedema care. So that's some good idea if you want to kind of get into that referral source. And again, like I have classes that tell you how I have the plastic surgeons refer their clients to me and get in touch with the plastic surgeons and convince their offices. A question was, who do you recommend becoming a CLT therapist through? So we went to two different, I went to Close. There's also Norton, there's also Acoles, there's also Dr. Potter School, and all of them are very highly and well respected in the industry. So that is actually that question that Moms Get Fit To said. That was a question that started off my career because I asked it to Jeanette Durand, and I said, look, this is what I want to do. I want to get these referrals for people who are having, the swelling after the surgery. I want to do this as a lymphedema therapist. Which school should I go to? And she said, find the lymphedema training program that would be respected by the people that are going to refer clients to you. And that was like the deepest, like once she said that, it's like, I was like, of course, because I'm a close CLT therapist and you're a close CLT therapist. And I know, yes, and Dr. Chickley, and I know the teacher that taught me, and the teacher that taught you. And then that's how you connect with people. And then because you had the same teacher for some classes, so they know you're legit, and then they'll refer clients to you. So it says she heard the word lymphedema at this live more than I heard at the hospital today. 100%. Lymphedema it's not a rare disease, but it's amazing how few people know about it. And if you could put on my gravestone that she spread awareness about lymphedema and lipedema, like that would be a life well lived for me. So I love that. And someone did Acoles for MLD. So I got plenty of votes for Acoles. I got 3 votes, 4 votes.
That's me. I'll vote for Acoles. Just saying.
Yep. Yep. And then interesting. So Marcella said, Kathleen, is there a way we can see your portfolio of clients before and afters? There's amazing info on your page, but I couldn't find pics. You can't find pics for a specific reason. And that's because I don't take pics. I do not have to advertise my services on Instagram. So that's why you do not see any before and afters on Instagram. My clients are 100% referred by their plastic surgeon. So I will say, if you want to see examples of what the plastic surgeons do that refer clients to me, a big one is Dr. Torres, Dr. Steve Torres at Skin and Skinnier, and he absolutely has before and afters. So you won't see, he won't say, oh, Kathleen helped on this, because that's HIPAA, information, and we would always want to keep that information private to the client. But that's basically why you see my education and you see my classes, but you don't see any clients there, because I don't take before and afters, because it's not, I don't do, and if everyone else does before and afters, and it's no shade on anyone else, absolutely, like Ashley takes before and afters, no shade on anyone else, but the result, the after, is in the client's eyes. Like, it's not in a picture that I take, it's in when they look at the mirror, and at the end, they're like, you know what, I made the right decision with the surgery, and I made the right decision with Kathleen. And that is how the plastic surgeon gets them into the office but it's my work on each and every session that gets the rebook of the client. So that's how I get my clients, and that's how I'm able to have such a successful practice and not have to do before and afters of clients.
Anything else?
Just get a bunch.
I was just scrolling real quick too.
Yeah, apparently everyone loves.
Everybody in here is Team Ackles. My goodness.
Team Ackles. Yeah, I am so happy to see so many Ackles people. One of my favorite people, Paula, in the lipedema world, she is an Ackles trained CLT, and I love the heck out of her, and I love all of my sisters in CLT world that have had Ackles. And I look forward to seeing as many of you as possible at the NLN conference this fall. And if you're a member of the National Lymphedema Network, we do get together, and that's another good class opportunity. If you're a member of the National Lymphedema Network, we have webinars on each different section. So I was able to speak and be the speaker at the private practice webinar. There's also a modalities webinar, and all different, like, surgery webinar. So that would be another resource, and I should add that to, like, my brain when I tell people about resources. Absolutely, it's the best money you'll ever spend to join the National Lymphedema Network, and then you get to go to these webinars, and it's held like every week a different topic. So if you want the latest on surgery updates, like last month, earlier this month, we had like an hour-long webinar where Dr. Granzow, who's a plastic surgeon from Florida, was talking to us about the surgery he does on clients, lipedema, liposuction surgery he does on clients, and microsurgery, and how how the CLTs can help their clients after these types of plastic surgery. So that's, yeah, definitely, it's valuable. And then you go to the conference, and then you get to learn from Karen Ashforth. And there's actually, it's a very, very surgery focused this year, because we're at the Cleveland Clinic. They're going to do some like dissections. They're going to show you all different parts of surgery. So if you're interested in plastic surgery, that's a great opportunity. And someone wanted to list the schools. The ones that I know of: Chickley, I always forget, so I'll put it first. Chickley, Close, Vodder, Close, Dr. Vodder School, Norton, and Ackles, which is the clear favorite. There, someone else said it, which is the clear favorite. And there's also Leduc, Casely Smith. I know the Casely Smith instructor in America. Yeah.
Hildegard.
I love this. Someone said it's a dark industry and dark, nasty people, but ultimately the clients are who matters. Absolutely.
Yeah. I mean, I didn't even know this industry existed. I didn't know there was an industry. I was just out here, like you said, you know, you start offering MLD and cancer patients, facial reconstructions. I mean, I think the craziest thing I've seen is the entire cranial section and face swollen from bad PRP injections. Completely, like ear to ear, back of the head all the way down to the chin. Immediately, the I guess injector called me on Saturday freaking out. I was the closest person available that offered MLD, sent 3 of her clients to me for consecutive sessions for 8 days straight. Mm-hmm. So you get all kinds of swelling, edema issues when you start an MLD. So if you're going to offer it, you're going to get plastic surgery clients. I mean, that's how I started. Nobody grows up and is like, I'm going to be a plastic surgery recovery specialist. Yeah, that's my dream. No. We don't even, like, nobody even wakes up and goes, I'm going to be a lymphatic drainage specialist. That's my dream. You just do it one day. Somehow you find it and you fall in love with it, and it takes over your life. And then because it's not so, widely out there, a lot of people find you for MLD for all kinds of things. So it is something where if you really are going to advertise it like that and not just have it as an addendum to your practice, you should get a CLT, certified lymphedema therapist training, 135 hour with any of the schools, just so that you have it in your tool belt. You don't have to work with cancer patients. You don't have to work with plastic surgery patients. You can tell them no. If you don't want to work in the world of post-op, because you do have to be super into it, if you don't want to work in that world, you can say that you don't do MLD for post-op. You only do it for these following things: for postnatal recovery, for autoimmune, Lyme, cancer, fibromyalgia, all the things, regular edema, regular leg swelling, like all the things that aren't post-op. You don't just have to do that. Because again, as we said, MLD is not just post-op, and post-op is not just MLD. So if you're interested in this, because you guys are asking a lot about it, if you're really interested in doing MLD, because I mean, I'm addicted to it, and so are you, Kathleen. We're kind of like, we just got sucked in and never left. But if you're that super interested, do a CLT course.
I don't have a problem. Say I have a problem? I have a problem? I can stop any day. No, I can't. I can't.
Oh, really?
Yeah.
Is that why we're on the phone till 2 a.m.?
Totally stop. Don't worry about it.
Because we can,
I'll stop next week.
we can stop at any time, right?
No. But that's actually a really good point, because like you don't hear about this. Like I had like 1 day of it in massage school. So I knew of it. But it wasn't until I started with oncology massage and I found out that there was a disease called lymphedema, which is a side effect of cancer treatment. And the treatment, if you are going to help someone with lymphedema, you should do something called manual lymphatic drainage. If they're at risk for lymphedema, you should do something like called manual lymphatic drainage on them. So it's like a passion. It started very early. I did not get into massage therapy and then accidentally wander into the wrong classroom and learn about post-op massage. Like my first clients that I ever worked on from then until now, surgery, after surgery, it's been my passion. And you can see on my resume that like there's a clear, it's just every month I want to learn something new about this. And every month it has given me such, I have so many people that I've been able to help that are hugging me, that are saying, you know, that I made their journey into recovery from cancer treatment better. And it's just, and maybe also if we could widen somebody's horizon where maybe they got into it because they see like maybe you can make money off people with liposuction. If you learn MLD and you love it, there is such a wider opportunity for you, and there is such a wealth of education out there, and you can really have such an impact in people's lives with MLD if you would consider, especially if you already have like the soul and heart to help somebody who's suffering after surgery, and not just do like a cookie cutter massage and tell them, oh, it's supposed to hurt, don't worry about it. Like if you really want to relieve suffering for your clients, like oncology massage is a beautiful modality to move into, and you can definitely have the bulk of what you do be post-op if you want to, but to be able to help someone after, you know, with on their cancer journey is so deeply it's so deeply meaningful to me and to everyone that I meet that does oncology massage. It's deeply meaningful to me because I lost both my parents from breast cancer. I'm sorry, both my parents from cancer. My mother had breast cancer. She died when I was 19. She was first diagnosed when I was 9 years old. And I lost my father 11 years ago from lung cancer. So if I can take my hands and help somebody who is suffering on that same path and give them a moment of respite, a moment of solace. That's the name of my company, is Solace Massage and Mindfulness. If I can use these hours that I've spent in the classroom and this understanding of surgery to help people like I help when the doctor refers clients to me who have autologous reconstruction after their breast cancer and their mastectomy. And if I can say, you know what, this is a beautiful place. You're not going to feel any pain here. You felt a lot of pain over the last 2 years, but I am going to give you this treatment after liposuction, and it's going to be MLD, and it's going to be some post-op massage. And if you have fibrosis, we are going to reduce it. And I am not going to cause you any pain. I'm sorry, I'm going to cry. because I wouldn't. Like, my mom died when she was 19. Why would I have someone on my table and cause them pain? Why would I think that that is how I am going to be in the world? So if you see me, and you'll see me in the future, and I will always be saying, like, let's get better. Let's get better at what we do so we can cause less pain and get better results. And the core client of mine, like, I love my BBL clients. Don't tell Steve Torres that I don't love his clients. But my core client is the lady who's been through cancer, and she had a fat transfer. And you know what? I gained everything that I learned from doing all my BBL clients is so I can give her a massage without any pain and have her walk out of there standing taller, feeling prouder, and feeling like, you know, this is the journey from the cancer that she has beat into her recovery and the rest of her life.
I actually never knew, we never actually talked about like our stories like that before. This is like the first time we're doing that. Because the reason I started my practice, so it's Amare Healing Arts, is because Amare is the root of all the words of love. It's Latin. It's the root that all of amare, all of it starts from Amare. And then Healing Arts. I started it because I'd been to so many doctors, so many neurologists, gene doctors for like genetic testing and all kinds of crazy shit as a child. Like, as a child, I had lymph nodes removed under my neck because they wouldn't stop growing. I had hormonal issues they couldn't find anything in my blood. They couldn't, like, there was no markers for anything, yet I would be out of school like at least 4 days every week, crying on the bathroom floor and not being able to walk because I couldn't feel my legs and I couldn't function. And no doctor could help me. I literally went to a doctor and they like squeezed my joints and they were like, no, you're fine. There's nothing wrong. And I'm like, okay, so tell me why I'm having a complete nervous system attack. And as I got older, it got worse because I don't have those certain proteins in my blood, which we found out through genetic testing because my dad also has it. So there is no cure. There is no treatment. Every doctor was like, oh, there's not even a problem, until this one guy who was doing a research study picked us to do it because of the symptoms. And I mean, it's debilitating to the point where you are paralyzed. Your nervous system paralyzes you. It feels like someone pulled the plug on your body. Like, I remember I was standing in the kitchen and I couldn't hold a coffee cup. Like, I was holding it and then my wrist just gave out and it was all over the floor. And I just broke down crying because I was so helpless. I couldn't go to college because of school issues and all of that and medical issues and everything. There was no like path for me to take. There was nothing for me to do. I didn't know what was going to happen. So I became a yoga instructor because I had a body issue and I need to figure it out. And then I was like, okay, well, doctors don't know what they're talking about with me. And I clearly have an issue where like, even there are still days where I can't breathe because my collarbone pops out of place and chokes me. Like, and they're like, you're fine, relax, you're fine. And I'm sitting there at 17, not knowing what to do with myself because I'm in crippling pain 24/7 that no one sees. And I thought, if I could just help myself, I could help so many other people like me that think they're crazy, that are alone, that have no family, have no support, are completely by themselves and have nothing. Like, that people think you're crazy. And that was my mission. It was like, you know what? I'm going to fix this myself so this doesn't ever happen to anyone else. Ever. Because this is not fair. Because I don't have health insurance. Because I'm 17 and on my own and can't live in the world. Like, this is not okay. I'm never letting this happen to anyone ever again. So I did the yoga, and then I was like, okay, my yoga babies, my little students, all had like body limitations and things. And I was like, there's got to be a way to physically fix this. So then I became a massage therapist while in school for holistic health and Ayurveda. So I have 2 different holistic health certifications. One specifically Ayurveda and one is holistic health, like national blah, 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 holistic health. So I went to massage school, and then right out of massage school, because again, with my issues, I was like, I need to physically help people with this. And if I can find a way to do that, my whole torturous life will be worth something. Like, this that I've gone through will be worth something. Because for anyone to have the life that I had and the treatment and the mistreatment and the pain and being told that you're crazy and there's nothing wrong with you and your body's fine and your blood is clear and your hormones are clear, yet you can't walk, you can't breathe, you can't open your mouth to speak because you're in pain, and you can do nothing but sob for days. That is bullshit. And I will never let that happen to anyone else, which is exactly why when I started with medical massage. I never did Swedish massage. I worked at a Hand and Stone doing medical massage. Within 2 months, I was the top therapist there. And then I left and I was like, I'm out. I'm going to go help more people because this is not, I can do more than this. I am more than this. And there's a reason. So I started working at a medical massage internship. So there was that. And she was working with lymphedema patients. And actually, that patient is still a patient of mine. And I call her like my aunt because she's my little Hungarian aunt and I love her to pieces. I see her once a week and she's the best. But that's how I got introduced to lymphedema. Then I took the MLD and that was like a month out of school, like 2 months out of school. And that's all I've been doing since because it saved me. It literally saved me. I haven't had an attack in 5 years, except for like 2 months ago because I was hella stressed. That's my fault. Just saying. But there's nothing wrong with me. I'm perfectly fine. I rock climb 3 times a week. I work 10 to 12 hours a day, 4 days a week because MLD, because limiting caffeine, because pH levels, because holistic health, because yoga, because being gentle with myself, because I will never let that happen to anyone ever again, because no one should have to go through that in post-op. No one should have to go through that with autoimmune diseases. No one should have to go through what you saw your parents go through with cancer and all the lymphedema recovery and all the complications. No one should ever feel that way, the way I felt for 17 years of my life, completely alone and pushed to the side, including making you guys go crazy with post-op stuff, just to bring it back to the point of this live and not ramble. But yeah, that's also why I'm so passionate about post-op, because I know how that feels. I still live with that every day, because when I had that attack, and Happy Alex, you guys know who Happy Alex is. Happy Alex, I called her and told her I can't come, like, you need to, like, no more clients for the rest of the day. I can't, I'm not okay. And she heard me crying. She was worried, because that's not me, ever. She was severely worried, and she was like, what is going on with you? I'm scared. This is not okay. Like, oh my God, because I live it so much and I manage it so well with MLD, with all this stuff, that I don't ever want anybody else to feel like that again. So I make sure I'm good so that I can teach my clients that, because I know what that feels like. And it's not fair for you guys to have to go through with an elective surgery that you're trying to better yourself with. That confusion, that pain, that loss of self, that is not necessary in your post-op care. And the point of me starting Amare was to show everyone in post-op care, medical massage, all of those debilitating conditions, IVF therapy, hormone therapy, trying to get pregnant and you can't, after pregnant and your body's all weird. You should never feel that feeling, ever, when it comes to taking care of yourself, because there is a better way, and we're going to find it no matter what it takes. That's the end of my story. Mic drop.
Yeah, I mean, I love that, and I think it touches something very deep in somebody who has come to massage or come to the practice of medicine, however it is, the people who are listening, however you give the medicine to the people in your life. This is why we're both on fire, and I think to understand the backstory, you can see why we're so passionate. You can see why it's not about the dollar. It really is about the client. And you can see why sometimes we're a little bit, like I'm very, very strident about pain levels, because I have cracked the code to reduce fibrosis. It took us 2 years with me and Sherry Scott, and we back and forth. She was my colleague and counterpart in North Carolina. And I said, look, I'm trying this. Like, let's try cupping. Like, what did you do with the cupping? And let's try these foams. She was a CLT as well. And I was like, we got, between the both of us, like, I really want to figure out how to reduce fibrosis on clients and it not be painful. And this is, I think it took us, like, I don't even know what time it is. It took us 8 million hours to get here. But like, that's the real, you peel back the onions. And I think that at the core of it all is love. a deep love for our clients, a deep love for this work, a deep passion for this work. And that's what puts all the certificates on the wall. That's what gives us this drive to share with all of you and to share this really strong message with every one of our counterparts that we can, that there is no like cookie cutter, it has to hurt massage solution for these clients who are in pain because they just had surgery. And that's why we're so on fire to spread this message. And so everyone understands that there's more than one way out there. And if you're interested in helping clients without causing them pain and helping clients after all different types of surgery, and in helping clients who have a cancer history, if you have the proper training, that's why we want to stand as a resource for you. And when, life gets you down and you just see all these, yet another video and yet another comment of people saying like, oh my gosh, I fainted, or, oh my gosh, it was so painful, I didn't want to go back. Just know that there's another way out there, less painful recovery for clients. And there's a team of therapists from across the country that are also working, and we're working in our offices every day to bring these spectacular results to our clients. Yeah, and she says that, we always know that there needs someone to be there for us. We need to remember we all need someone who can always be that someone for one who needs it. So yeah, we can definitely support one another. So did you have anything else you wanted to say before we close?
I think just to wrap it up, I mean, because this is supposed to be like the dark side of post-op.
Yeah.
It's what you make it. It honestly is. Because in my world, like I said, there is no dark side. I mean, you guys come in, and this is the thing. Even if you are on your hardest day and you're frantic and you're free, I mean, Jocelyn is in here. Jocelyn can throw it in the comments of how many times she's called me freaking out, and I just like, calm her down, tell her to take a deep breath, and then we get to the medical shit, and we figure it out. And then she's okay. And that's like once a week. That was like our once a week virtual. That's what it started with. Yeah. And then the foams, and then the garment, and then the massages, and then all the other stuff. Post-op is what you decide it's going to be, not just what you make it. You can decide not to get those massages and just do MLD. You can decide to only do post-op massages or squeeze massage, which is you shouldn't be doing, or that, and not do MLD, and vice versa, or do both. You decide if you want to deal with that pain or not. You decide if that pain is working for you or not. Because I know the same people in the comments that are saying, oh my God, it hurt so bad, and right after, but I was so small the next day though, and it was fine. It's if that works for you, cool. But you get to decide if it's going to be painful or not. You get to decide if your surgeon is worthy enough to work on you and to be hired by you. You get to decide which post-op thing you're going to do and listen to and protocol you're going to follow and what's going to work for you. So there is no dark side. It's your decision. It's your responsibility. What makes it dark is when you have people who did only the one thing and are really mad that they did only the one thing because they're lost, frustrated, confused, sad, and in need of a hug. Anger is a symptom of another emotion. 90% of the times, that emotion is a feeling of being hurt, sad, lonely, lost, frustrated. Anger is the umbrella to all of that. So if that's how you're feeling, and if you are seeing this as the dark side of post-op and just body contouring or just massage or just post-op massage and just MLD, like all these different things, it's not about that. It's not about that. It's about you being okay. That's it. That's it. So there is no dark side. It's your side. Pick your side. And not even a side. Pick what you want to do for you, what feels right for you. That's it. All I gotta say. Yeah. Ashley with Amare.
Yep. Choose yourself. Choose. That's the most important choice you can make, is to choose yourself.
Yeah, use your own damn wish picks.
Yeah.
Like Jocelyn out here with that flex of her own wish picks.
Yeah. Yeah. but plastic surgery is your own journey, and I went through it, and I'm still going through it. I'm in my first 6 months post-op, and plastic surgery, my journey started when I chose myself. Yes.
Well,
right.
I think that's it. We covered all the 4 pages of notes I have here.
Always wonderful to spend time with you. Thank you so much.
Yes, so much, always. And I have this recording. I will post it on our YouTube. I don't know that IGTV is going to let us post it because it's so long, but I will take clips, like snippets, and put them up. But it will go up on the Amare YouTube. It will also be on the Amare podcast. That's probably the best place to listen to this, because you're not going to see the comments all over my face and the scrolling back and forth. So if you guys don't know, Amare Healing Arts is the page. I'm tagged in the little flyer, so if you guys want to go follow that to rewatch this if you missed a bunch of stuff. The link to the YouTube is in our bio, along with our post-op shop to the foams that we were talking about, and all of the supplies and stuff, and the videos to the at-home care, and all the questions you guys had. All that is in the link in bio. This video will go up on Friday. You're welcome. You're welcome. You're welcome. I'm watching the thank yous. You're welcome. You're welcome. You're welcome. We love you guys. We love your support. We love that you listen to us just like talk about all this stuff and nerd out, because Kathleen and I have had so many phone calls like this by ourselves already. It's so nice to do it with other people who understand. But yeah, that's it. Check us out. Kathleen, those resources are really awesome on her website. Her classes are freaking awesome. So keep that up too. And that's it. Maybe we'll do this again because this is fun.
Yes. Thank you. Have a great day.
Bye.